Hello again. This is Ryan with Raj. We're both physical therapists in doctors in physical therapy. And we are wanting to be here to share some information and tips with the folks out there on what we can do to help out. And what we come across a lot of is some ankle foot injuries. And there are quite a number of different injuries out there based on the foot, but I'd like to throw the question to you, Raj. What do you find a lot of in the home health setting?
Thank you, Ryan. Mostly the people that I see frequently arthritis. Any joint arthritis is the most common diagnosis. And some people after falls, they break ankles, especially if there's an impact, like if they fall on stairs, that's where they land on, the ground with the foot, impact. So that's when we see, fractures of calcaneus, which is a heel bone. That's another one. And the third one is sprain. So sprain can be, while doing the stairs, or it can be tripping incident where a patient's foot is stuck to a carpet, or and their body goes forward, bending the ankle. So that's where the sprain, either medial or lateral, to the joint, or lateral means outside, medial means inside.
Right. Yeah.
The ankle. So most commonly seen is outside injuries. Less common is inside the ankle. So these are the main three categories of ankle injuries that I see in home health.
Yeah. So like an ankle sprain, it's going in a certain direction that goes beyond its threshold, and then there's a tear or an injury happening. But then we've got some signs and symptoms, like what might differentiate an ankle sprain, the pain, discomfort that you feel in that, compared to, a fracture or maybe even arthritis. What tips could you help us with on that?
In ankle arthritis, especially arthritis, is similar to the knee or hip that we talked about in previous videos. The arthritic pain worsens as the day progresses. And if there is arthritis, usually the first sign you can know is by feeling the joint. If the ankle feels warmer than one other ankle or other joints, that means most likely there is inflammation and probably arthritic changes that cause some inflammation and pain. That's one way to look at it. And again, the emphasis is initially when as the day begins, it may be fine, but as the day progresses, the pain worsens. That's the most significant sign of arthritis. Obviously, in fractures, there will be sharp shooting pain. That's you can't miss it, and you won't be. Patients won't be able to bear weight on a fractured bone, so it will be swollen, very painful. And most likely, if they're even for hairline fractures, the orthopedic surgeon or expert may put the ankle in a boot so that you're not putting too much weight on that joint. So typically that's the case, but again, it depends on how bad is the fracture. The surgeon may decide to just put a cast and not do anything, boot or anything, or they may just tell you to not put too much weight on it, and they don't put any cast or any boot. So there are, depending on the fracture type, it varies. And the sprain, in ankle sprain, the most common thing is swelling, edema. So really puffy, pitting edema, Sometimes it may be shiny, the skin is shiny and no pitting because there's too much fluid in it. So the best thing, if there is swelling in ankle after incident, like a sprain, the best thing is icing, elevation. Those are,
Yeah. Mhm.
rice is the best thing to do. So
That's right. What does
resting,
rice mean? What is
I
that?
know that's so first R is, rest. The ice, rest, ice, um, compression, which is, wrapping ace band and wrapping the ankle, um, so that the swelling is not staying in the ankle. You're pushing the edema towards the swelling, towards the major joints, towards the heart. So RICE is elevation. So you're lifting the foot above your heart level, which is usually 4 inches, at least 4 inches above the heart level. So that's what elevation is required. Most people, they think, they put their leg on the footrest and they think that's
Yeah,
fine,
right.
but that's not sufficient. So the foot should be at least 4 inches above the heart.
Mhm,
That
mhm.
way you're channeling the fluids towards the heart.
Right.
So rice is the best for especially ankle sprains.
Good. Yeah, it's a good place to start. And I think with the swelling and the ankle fractures or foot fractures, I mean, they can kind of almost be very identical. And I would find that if you have trouble putting weight on it and it's painful, that's
Exactly.
definitely a sign you got to get it looked at, because maybe it is just a severe sprain and it's good, but maybe that sprain got to the point where, it broke a bone too. And
Right.
so they'll
And
need to get it x-rayed and rule it in or rule it out. And then
exactly.
you got your doctor to give you the protocols to abide by, but he'll still want you to elevate it and ice it and have compression on it. So those are some of the things and some treatments that we talked about with that. What about arthritis? What's a good treatment for arthritis in the ankle? Because you got to
So
use
the
it to get around.
Right, yeah. So the first thing I would do is ice. I love ice packs, and I recommend ice pack to anyone. It doesn't have any age limit. It doesn't have any side effects. It is available in your home. If you don't have ice pack, you can use a frozen mixed vegetable bag. Anything you can use for ice in the home, what is readily available. 7 to 10 minutes, multiple times a day, even 5, 6 times, whatever the need is, how bad the pain is. Obviously, if the pain is above 7, you have to see the physician. If the pain is below 7, which is 5, 6, that's still pain. It hurts, but you can try ice pack. I don't like to tell my patients to use heat yet, especially if they have swelling. I tell them not to use heat. So that's one thing I recommend my patients. Not ice is the best place to start. Heat is only in some situations I recommend
Yeah.
heat. Though, yeah, that's the first line of defense in my line of treatment, not the defense. And ultrasound, when you go to therapist, they may use ultrasound. That's another one. There are some other treatments that has to be done in the clinic by the physical therapist, like ultrasound, that can be done. Iontophoresis is one thing. They um, immerse the ankle in the water and treat
Yeah,
with
yeah. Mhm.
ultrasound. That's one. Yeah, there are so many different ways to treat the arthritic pain. Um, taping helps in some people, especially ankle sprains. Kinesio tape helps. Also arthritis you can try, but I don't know. I know I took a kinesio taping class, and in that class, they told a lot of people like the tape is like, if something is hurting, my wrist is hurting, first thing I do is put my hand just to wrap, hold my wrist. That gives me a little comfort. Just that kinesthetic feeling gives some comfort. Tape, it kind of, helps in the same way. You put a tape, so it feels like, touch, kinesthetic feeling. So that
Yes.
itself sometimes, helps patients. So those are some of the things, it depends on, the physical therapist and type of the injury. The physical therapist may give you, options.
Yeah. Great.
You have anything you need to say, you want to say about?
Well, I think those are some great advice and some things to get started with, just to kind of help get control of the situation. And we want to, like with a lot of it, just control the inflammation and control the pain. And one of the things with arthritis, we know, like, hey, it just needs to warm up, and maybe there's some simple things you can just move the ankle around, kind of get it warmed up before you get on it and get moving. But yeah, thanks for the advice and input, Raj. And to our viewers out there, if you guys have anything you'd like us to touch on or discuss more of, do leave a note, and we'll get on it. Thank you.
Thank you, Ryan.